It's definitely one of the key considerations or questions that we hear when we begin implementing chronic care management within nephrology groups. Usually the first question is, oh, well, these patients aren't that severe or late stage. Why would they need this service? Oftentimes what we find is those patients are sick enough to where they require at a minimum 4 appointments a year. And what we know about those patients is they're probably going to wind up dealing with at least one or two exacerbations in that year that are going to require some form of intervention, in worst case, a hospitalization. The idea behind this program for patients is first and foremost, you're helping them stay in stage 3A and 3B as long as possible. Right? The worst case scenario is they have an incident happen that was preventable due to diet or exercise, and now they're at stage 3, or now they're at stage 4, maybe 5, even ESRD, when it was really something that could have been prevented through behavior change over time. The second consideration is a lot of these patients oftentimes don't have someone that they go to regularly or as regularly as you, their nephrologist. And the end result is they view you as their primary care doctor. So they're going to be reaching out to you with questions for support on medication, for diet, even just general questions about symptoms they may be dealing with. That's going to happen regardless. You might as well do it in a way that's proactive, that's scalable, and ultimately a way that drives reimbursement for the group if you have to do this work anyways. The biggest reason would be to prevent further progression due to preventable issues. The unfortunate truth about a lot of these conditions is they are significantly improved through very simple things. Diet, exercise, and medication schedules go a long way. The challenge is for patients that are on their own, it's very hard to do those things and do them well because, as you know, they may have many different medications that they're taking. They may be getting different advice from different doctors. And for example, if you go to WebMD, you can find a plethora of confusing information that doesn't make any sense. So really, the idea here is that these patients now get a resource that's there to help them as a trusted guide. And they're no longer handling their healthcare on their own. The worst case scenario is a patient misunderstands something that they hear from you in the office and they don't take their medication correctly or they don't follow the right diet, not because they don't mean to, but because they don't understand it. And 2, 4, 6 weeks down the line, you may think that the patient's very healthy, but they've recently gone to the hospital and are now in a stage 4, stage 5 status. And now you have to really work to manage their care and reduce their cost. So the simplest way that we would think about it is bending the cost curve before it ever gets high so that you can drive major care improvement, quality improvement, and cost savings before it becomes too late to manage.